Hello, everyone. I wanted to introduce you to my friend Dr. Richard Elcock, who is here with me today to participate in my first ever podcast.
Awesome. And I'm honored to be your first guest. Thank you so much for having me.
Yay!
Awesome.
The whole goal of this is for me to walk the talk and to be a better ally. And I thought to myself, what better way could I do this than to be able to speak with, interview one of my friends who is an incredible human being and
Thank you so
who,
much.
yes, and who I think it's necessary for the world to hear his voice.
Well,
Okay.
thank you so very, very much. I really
Um,
appreciate the opportunity.
Absolutely. So before, obviously, I'm going to go through the questions with you. I'm going to give
Mhm.
everyone a little quick bio about you so they know who you are.
Sounds great.
Um, so Dr. Richard Elcock is a GTA native, born in Toronto and raised in Mississauga, Ontario. He's a first-generation Canadian of Afro-Barbadian and Afro-Jamaican descent. He holds dual certification from the Royal College of Physicians and Surgeons of Canada in both general psychiatry as well as child and adolescent psychiatry. He is currently in practice in St. John's, Newfoundland. Are you
Absolutely. That
ready,
is
Dr.
well, thank
Elcock?
you. Indeed, I am. And I guess before we get started, I just want to make it absolutely clear as well, too. All of the ideas and opinions expressed on the podcast are absolutely my own and do not reflect on any academic or professional connections that I have to any institution or health authority. Absolutely. All right.
Perfect.
Mhm.
Alrighty, Richard, we'll start with some of the easier questions.
Yes.
What defines you?
Right. I guess what defines me is more and more, especially as I've gotten older, is healthcare provider, healer, and increasingly advocate. And I think in my line of work, working in mental health and addictions, it's become increasingly important to me to provide space, to provide a safe space for the most marginalized among the population of mental health patients that I serve. Absolutely. And certainly my work revolves primarily around child and adolescent psychiatry at this point in time. But absolutely, I do definitely do work with racialized patients from time to time. But then I also have had the opportunity to work with LGBTQIA2S patients as well in my practice, and certainly giving them a safe space to come in and to realize that they're receiving care that is indeed affirmative, that totally encompasses their whole lived experience and provides them with a space free of judgment to speak their truth and to be heard is very important to me. Mhm.
Amazing. Now, Richard, did you always know you wanted to be a doctor?
Right. Great question. And I would say from an early age, to be honest with you, yes. And I guess I'm one of the lucky kids maybe who grew up with parents who didn't push me into this. I certainly was inspired by my mom, who's a registered nurse. She works in a very different area of medicine altogether, actually. She's a neurosurgery ICU nurse. And hearing a lot of what she would come home and share, of course, age appropriate around the type of work she was doing was always really inspiring and sounded super exciting. And I was really drawn to just healthcare and being a healer and helping the most vulnerable at their neediest of times. I think all of that really, really appealed to me from a very young age because of my mom. And certainly my mom was not even just a healer in just her work line, her line of work rather, but in terms of just being a healer in a safe place for a lot of people in our family, a lot of people in our community in general. And I think being inspired by her absolutely would have had me consider a healthcare profession as really high on my list. It didn't really waver a whole lot throughout elementary school or even high school. Absolutely, medicine kind of stayed at the forefront of what I wanted to do.
What I find interesting is you used the word healer. And
Yes.
for me, that word kind of resonates with, it connects a little bit with a lot with spirituality. Am I right to assume that?
It could, I guess not necessarily so. And I get experience with, parents born in the 1940s. A big part of my own experience absolutely was rooted in Christianity, and certainly a more non-denominational Christian tradition is kind of what I grew up in the midst of, as well as elements of the Anglican experience as well too. But in terms of where I sit today, in terms of my position on being a healer, it's very much so something that's not necessarily linked to any religious affiliation, and certainly recognize within health and mental health in general, spirituality can be a construct, which is extremely important to our patients. So I certainly take them as they come with respect to where they stand on that, whether it's kind of, again, more so agnostic, perhaps more so atheist, or perhaps actual affiliation with a particular religious body. I think, we receive all of that and respect all of that as it comes our way, but I don't think it necessarily needs to imply a religious element per se. And kind of that sense of connected to something greater than ourselves. If one can kind of conceptualize spirituality as being perhaps an extension of that, absolutely. Spirituality can be part of that healing process, right? And I think certainly, looking at the biopsychosocial spiritual model of mental health care, certainly that's something that a number of us obviously strive to adhere to, and we try to conceptualize our patients through that lens. So yes, the spirituality can be a part of it, but not necessarily something that I'm directly addressing in day-to-day practice with my patients per se.
Okay. So with everything going on, tell me about the last time that you experienced absolute joy.
Oh, right. I would have to say, Hanye, that would have probably been last October. So I had caught wind of a really great seat sale to Greece in spring of 2019. It had been a place that had been on my bucket list for years and years and years. And I'm like, you know what? I'm just going to book this and go. And I kind of put it out there to my circle of friends, and folks were initially excited, but then as time drew on, as often is the case, people realize they can or cannot make it for any number of reasons. So ultimately I ended up going on the vacation myself, and it was certainly exciting, but also it was a little different because I don't know if I had done a trip of that magnitude that far away from home for this period of time. I was actually over there for 2 weeks, and it was such an outstanding experience. It was absolutely incredible to be in the midst of such beauty. The people over there were super, super warm. The food was exquisite. The weather could not have been more perfect. And just to be there, exploring this country that I'd never been to before on my own terms, just, seeking out adventure, seeking out new experiences was absolutely joyful for me. So I would absolutely say it would have been last October of 2019 when I had the chance to kind of hit Greece. Absolutely.
If you could make someone understand, like already, like if people who don't know you, they hear what you're saying and your incredible experience, whether it's through your work or traveling, tell me if you could make someone understand your truth, what would you say to them? Right.
Great question. I think in terms of understanding my truth, when we talk about what it's like as someone who may hail from any number of experiences, including the LGBTQ I experience as well too. When we talk about understanding what it's like to live at intersections, it's something that I'm certainly mindful in terms of my own lived experience, but absolutely I'm certainly mindful of in terms of my patients as well too. And so I think that in terms of what my truth is at this moment, I feel very much so rooted in the fact that it is a spirit of openness to learning, to really hear the experiences of others and really truly try to understand others, and staying humble and staying open to learning from experiences and the stories of other people. That's extremely important to me. And I think if a lot of us did more checking of our own preconceived notions and more just open listening, open dialogue without judgment, perhaps things may look like quite different in a larger sphere as well too. And I think that that's what I try to do each and every day, is really to listen, to really try to understand the perspective that people hail from, and hopefully open up dialogue then by extension of that, with the understanding that we're perhaps a lot more alike than we are different in any number of areas. And I think that's where we see change occur, to some extent anyway. So I think that staying in that place of openness to learning, openness to discussion, openness to dialogue, and promoting dialogue around necessary things is very much so my truth in this moment as well too. Absolutely. In light of what we've seen happen in the news within the past 4 weeks, I think more than ever people are having difficult conversations, things that we haven't spoken about in polite conversation before. And I think people are more ready than perhaps we have seen in a really, really long time to have open and honest discussions around race, to really open up the dialogue around things that we have known have been problematic on a larger scale, but haven't really addressed before because it just wasn't polite conversation. So again, being a part of that dialogue also is something that I think is really important, and certainly hope to have the opportunity to do in a constructive manner moving forward.
Great. Through your lived experience, tell me about a time when a situation had left an imprint on you.
In terms of a situation that's left an imprint on me, I would say certainly I reflect on patient care, certainly just because it's such a big part of what I do with my life at this stage of my life. Reflecting on perhaps the most vulnerable of patients that I've worked with in recent past and what things have looked like for that individual, navigating more nuanced aspects of provision of care. They can leave a lasting impression on you. And certainly I think that would be the example I would provide on that question for sure. You know what I mean? And realizing just how much we can impact in a number of cases, how things look for people. Sometimes the trajectory, the long-term prognosis perhaps of a given condition. In certain cases, there's not tons that can be done necessarily to change things, but sometimes there is the opportunity to get in there and make a difference. And certainly, I think, especially as child psychiatrists, we're well positioned to do that in a very unique way, obviously, interacting with patients at such an early stage of development as well, right? To hopefully impact what that looks like in a more positive direction.
Wonderful. Tell me what it means at this day and age to be a Black man.
Right. In this day and age, to be a Black man, I think, is to absolutely exist in a place where you cannot avoid the reality of the lack of value perhaps given to Black lives, to live in a place of skepticism, perhaps where not only your existence, but your motives are constantly questioned. And for a lot of us, this is nothing new growing up, perhaps as a racialized person, as a Black person in a North American context. I think having this discussed globally is what to do, right? We've been having these discussions within our community for a very, very long time as Black people. And in terms of what it means to be a Black man in this day and age, I think a lot of us more than ever are challenged to, again, deal with the fact that clearly, again, there are threats that we deal with. There are stereotypes that we deal with which threaten our very existence. And hopefully within that, being a Black man and realizing that we also recognize the struggle of other intersectional experiences, whether that be Black women, Black queer people, specifically Black trans people, hopefully being cognizant of all of these things is inherent to our own experience as Black men as well. And realizing perhaps that there needs to be much done to change how things look.
Yeah. Okay, finish this sentence. In 1 year.
In 1 year, I hope to be in a position that is allowing me to further amplify voices of the most marginalized folks in our society. And certainly I'm actively looking into ways that I can do that more effectively. And I hope to be able to kind of actually report possibly back to you on what that looks like in a year's time in terms of where I'm at in progress with that. And I think that would be it for sure.
That's amazing. Do you want to tell us a little bit about it?
Right. So in terms of locally, there certainly are organizations that have been present far before everything that occurred within the past 4 to 5 weeks. And I think certainly I have not been actively involved in those things in the past. But again, in light of the events that have occurred, you realize, okay, well, what am I doing to perhaps use my experience, my voice to make a difference in a bigger capacity? And certainly kind of making inroads with those organizations is something that I'd like to do a lot more of locally. Absolutely.
Okay. Now, Richard, in your professional opinion, how do we move forward? How do we heal? Like, this has been an ongoing conversation that I have with a lot of people when it comes to, you know, the impact of everything that's going on right now is so vast.
Yes.
What are some things that we can all do to be able to move forward with our mental health obviously being the forefront?
That's it. I think a big part of the healing piece is realizing perhaps that there is something wrong. And I think, to be honest with you, Hanya, that's something that's now occurring that perhaps hasn't in the past. Perhaps based on the fact that conversations around race, around anti-Black racism, racism at large, haven't been things that have been common topics in commonplace discourse. We haven't necessarily had an acknowledgement of the fact that, yes, this is not a problem that existed in the 60s and 70s and is now gone, which, believe it or not, is actually where a lot of people would have existed perhaps even up to 6 months ago, right? Mm-hmm. So the acknowledgement that, yes, there are significant issues, there are problems here, we need to move forward. Hopefully then becomes the impetus for people to actually want to engage in real change. And I think a lot of the healing part comes with the education, the understanding of what the problem is. And certainly I've kind of seen people from all walks of life really kind of looking for resource to get an understanding of what all of this means in a bigger sense. And that's a big part of it. And then perhaps looking within. And certainly perhaps that takes a certain degree of insight, a certain degree of humility to be able to perhaps look at one's own lived experience, one's own ideologies, one's own perspectives, and really get a sense of, okay, well, where do I stand with all of this? And maybe where is there room for possible improvement, possible growth, right? And I think for all of us, hopefully there's the impetus to do that more so than ever before as a result of what's going on. And I think that's a big part of the healing process, educating ourselves around perhaps that which is wrong, and then looking at ways that we can find, practical ways that we can find in our day-to-day life to be more mindful of those things and hopefully work towards living in a different way.
Any tips in terms of the practical ways?
Right. The practical ways, as I had mentioned just a moment ago, I do believe that getting educated, and especially for those of us who don't necessarily, our work or our life's calling doesn't necessarily revolve around race politics or equity, diversity, and inclusion, it perhaps means maybe getting our hands on books that kind of give us a preliminary or cursory understanding of what those things are all about. And certainly a number of those books, in light of what has happened within the last several weeks, are actually now at the top of the New York Times bestseller list. So again, researching those books are not hard to find. A simple Google search will probably, be able to put people in touch with those books that have been recommended by experts in the field. And that really helped to kind of give lay people understanding of what these things mean in a greater sense. So that's a great place to start, just educating oneself around what the issues are.
One of my favorite things always that I usually do whenever, obviously, when things are not going the best.
Right.
I have these conversations with God. Okay.
Yes, absolutely. Absolutely.
Really?
Absolutely.
There are times I'm like, really? I thought things were going to be easier. Remember that conversation last week or last year? If you could ask God anything, and not to say that we don't already have like a connection to a higher being or a higher source, whatever that could entail for you, right? What would you ask?
I think I might ask, perhaps how do we navigate this time especially most effectively? Because I think any number of us, there's been scholars who've done this work forever and a day, Hanye, and certainly they've made strides and there's been certain things that have improved, but obviously we still have much work to be done. And it would be awesome to be able to ask the creator of all kind of what would be the definitive steps to take to really change what things look like, especially as applies to kind of the racism piece that has come to the forefront in the last month or so. I think it would be really great to just get the definitive answer from the source of it all, if that were possible, right?
Yes.
That's probably what my question, especially at this time, would most likely be. Absolutely.
Okay. Thank you, Richard.
Yes, anytime.
For your incredible insight. Before we sign off, I have a series of rapid fire questions just to kind of
I'm gonna do my best. Yes.
Let's
absolutely.
see how we do it.
Okay. All right.
And they're I want it to be a little bit chill compared to everything else, right?
Okay. Easy enough.
Right. And these aren't necessarily questions that I already know the answers to from your perspective either. So
fair enough.
Nice thing for me too. Okay.
Easy enough.
Your guilty pleasure.
Guilty pleasure. Haagen-Dazs vanilla ice cream, preferably purchased at Sobeys, somewhere in between the hours of 12 a.m. and 3 a.m.
Oh my God.
You notice there was no delay on that one. Yeah, at all.
I feel like that's a whole different conversation. That's a whole different one of these again, because that was way too specific. Okay, all right.
We refer to that as SSB, secret single behavior, right? And let's face it, as singles, a number of us have it, right? So hey, I'll just own it. Put it
my God. I know you've traveled extensively, but have you been to any country? Is there a country you haven't visited yet that you still would love to?
Right. One that has been on my list for a while is actually Morocco. I've actually wanted to go for quite some time. I've actually done none of the Middle East, none of Northern Africa so
Let's
far. So I would love to go.
go.
I'm not even joking. Please let's. Because,
You know,
Hanya, I've wanted to go for such a long time. I'm so serious.
Morocco's on my list too.
Are you serious? Well,
I,
there. Look at
like,
that. I'm learning things. That is it.
yes, for my birthday last year, I was like, I
Amazing.
was for the longest time, I'm like, let's go to
Yes.
Morocco.
Yes,
Have you
yes,
heard of
yes.
the Blue City, Chef Chouin, I think.
I've
I
seen
don't,
pictures, yes.
I'm probably
It's
not pronouncing it properly, but
I wouldn't even know the pronunciation. Sure, you're miles ahead of me.
yeah.
But I've seen pictures, and it's just any picture I think I've seen
Yes.
coming out of Morocco is just absolutely mind-blowingly gorgeous, right? So it'd be amazing to get over there. And yes, I would love to go with you. So seriously, off chat, we'll make plans, right?
Yeah, let's talk about this. If we're
Dates and
allowed to
locations.
travel again, let's do this.
How about that, right? Exactly.
Have you been to Turkey?
I've never been to Turkey. I'd love
See,
to.
that's another place I want to go to.
Absolutely. I'd love to go there. Again, so much of it looks incredible in pictures. Again, I'm a big traveler, Hanya. I love to travel as much as time and work allow. But yeah, no, I haven't done much of the Middle East or much of Northern Africa or anything like that. I'd love to get over there and see that. Absolutely. Mm-hmm.
Bungee jumping or skydiving?
Ooh, if I had to pick, and anyone who knows me well would know that this question is a gag anyhow, because I hate heights, but it would definitely, there we go, and you're saying yes too. If I had to pick between one of the two, exactly, right? For me, it would definitely be the skydiving. I think something about, so the heights are gonna be terrifying regardless, but I think something about the bungee, like you're falling and then you need to swing until what? Like you're retrieved. That's not gonna work for me. We need to just kind of fall, and there needs to be a definitive, you know what I mean? I'm getting closer to the ground very slowly would be more preferable than I'm suspended in air waiting for someone to pull me up from yeah, that's not going to work. It would definitely be the skydiving for sure. Absolutely, hands down, no question. Yeah. Now, mind you, I've done neither, and probably in this lifetime won't. So, but just if I had to pick, you know what I'm saying? If I had to pick.
I am with you.
Right.
People's biggest misconception about you.
I think is that I am formal or serious all of the time. And I think for people who don't know me particularly well, perhaps that might be the impression. I think for folks who do know me well, they know that that is not the case, right? But I think, I guess, like maybe perhaps any number of people, we all have layers, and maybe it takes the peeling back of those layers that come with time and that come with intimacy to really see all of who someone is. But yeah, I think quite often when people kind of first get to know me or think they know me, and perhaps it's on a more superficial level, there's the impression that I may be quite serious or formal. And obviously, as perhaps you may recall over the years, Hanya, that's not necessarily. I definitely love a good time. My inner West Indian loves a good time as well too. So yes, absolutely.
All the amazing parties we've been to.
That is it, right? Right.
When was the last time you were in love?
Oh wow. Wow. So Hanya, I have to say that would probably be 6 years ago or so. Yeah, it's been a long time. Wow. As you're asking it now, I'm like, wow, damn, that's been a stretch. Right? So yeah, I would say that would have been about 6 years ago. And it hasn't really happened since. I mean, there's, folks come and folks go. But when you talk about like that that real in your gut, you know what I mean?
Here, right here, right in the emotional.
It. You know what I'm saying? All up in your feelings. 6 years, absolutely.
Okay.
Absolutely.
And last but not least,
yes,
all of us here in Toronto, we're like, when are you going to come back and visit us?
I am not even joking. Toronto obviously has to be the first spot that I go once things open up here. I think we were talking about this last time we spoke to Hanya. Newfoundland and Labrador is currently under a travel ban, in particular, obviously, the island of Newfoundland. So again, I would have to kind of quarantine if I were to leave the province and come back for 2 weeks, right? And so as someone who's working day to day and working to get paid day to day, I probably will not be leaving until that is lifted, right?
Yeah.
But once that is possible, absolutely, my first stop will be Toronto. I haven't seen my folks, obviously, now since Christmas time. My sister, all of you wonderful folks as my friends. So I'm looking forward to getting back and seeing Toronto as soon as is possible.
Yes.
Absolutely.
And we're looking forward to it.
Cannot wait. I will keep you guys posted the second the ticket is booked. So
I'm looking forward to it.
Absolutely. We're long overdue for a reunion, Hanya. It's been way too long, right?
So like that post-COVID party is going to be amazing.
Exactly, right? It's going to be absolutely incredible. I don't even know what the lay of the land now looks like in terms of going out in Toronto. It's been such a long time since I did it.
Yeah.
I kind of left that phase behind perhaps in my like late 20s. And so I haven't done it in a while. So it'd be great to get back and kind of see what the scene looks like now in Toronto. I don't know where people go for drinks. Is like College Street still a thing? I
I
know
don't know.
Ossington
I
had
haven't
become
been
a
in
thing
Toronto
for a while.
myself for a while, so
Right? So you don't even know. I know like last time I think all of us had all gone out for a night. I think it was like in the whole Ossington area. And I think at the time it was kind of up and coming as the spot for 30 somethings to kind of go out and have a good time. But I don't even know if that's a thing now. Who knows? So we
I
can
don't know.
discover
I don't know.
together. How about that?
Hey, at
Exactly.
this point, I don't mind just hanging out at the house. Come over,
How about that? How about that?
I
And
don't.
I mean, I'm sure you're doing the same thing, Anya, but I found that in my 30s in particular, the way that like we do the whole social thing now obviously looks really different than a decade ago. And it's just a lot more like dinner parties, like experimenting with some like a new recipe, having friends over,
Yeah,
trying some good wine, and just kind of taking it easy at like one of our homes. So that's definitely kind of the speed of things for me socially these days, and I'm loving that too.
absolutely,
Absolutely.
absolutely. Well, thank you,
Absolutely.
Richard. Thank you for
Thank
this.
you for having me, Hanya. I really, really appreciate it. It's a great opportunity. It's so good to do this with you. And I'm happy to come back anytime you'd have me. Absolutely.
Yes,
Mhm.
absolutely. I look forward to it. And
Absolutely. Cheers.
let's cheers and have a wonderful weekend to come.
Thank you so very much. And you too.